exploring the impact of expanding vaccine schedules on immune and neurodevelopmental health. Introduction. The introduction of vaccines did not have the impact on public health that agencies like the CDC likes to promote. The vast majority of childhood infectious diseases dropped precipitously prior to any vaccines introduced to treat them. Literally, it was plumbers, not physicians, and vaccines that improved the incidence of childhood illnesses due to better sanitation and improved nutrition. After the passage of the 1986 National Childhood Vaccine Injury Act, NCVIA, which removed liability from vaccine manufacturers' vaccines, became the sacred cash cow of modern medicine. Some have questioned whether the expansion of the pediatric vaccine schedule may be contributing to a rise in chronic immune-related and neurodevelopmental conditions such as asthma, eczema, food allergies, and autism. Hello, I am Dr. K. Paul Stoller, and this video explores these concerns and highlights the importance of rigorous oversight in public health policy, something that is sorely lacking. Historical context and the 1986 Vaccine Act. In the early 1980s, the vaccine schedule recommended by the Centers for Disease Control and Prevention, CDC, included vaccines for diphtheria, tetanus, pertussis, DTP, polio, measles, mumps, and rubella, MMR, fewer than 10 total doses by age 6. By contrast, children today receive over 30 injections for supposed protection against more than a dozen diseases, including hepatitis B, rotavirus, varicella, pneumococcus, and influenza, among others. The expansion of the schedule coincided with the passage of the NCVIA in 1986, which established the Vaccine Injury Compensation Program, VICP, and granted legal immunity to vaccine manufacturers. The intent was to ensure vaccine supply by protecting companies from lawsuits stemming from adverse events. However, this removed a key incentive for pharmaceutical companies to prioritize long-term safety, shifting the responsibility for post-licensure monitoring to the Department of Health and Human Services, HHS. In 2018, a lawsuit revealed that HHS had not filed any of the biennial safety reports to Congress as mandated by the NCVIA, a lapse that has fueled mistrust and concern. The rise in chronic and neurodevelopmental disorders. Since the mid-1980s, the prevalence of chronic health conditions among children has increased. Asthma, food allergies, eczema, ADHD, and autism spectrum disorders, ASD, have become significantly more common. For example, the CDC reported a steady increase in autism diagnoses from 1 in 2,500 children in 1985 to approximately 1 in 36 as of 2023. In 2025, it was announced the rate of autism in California boys is now 1 in 12. Better awareness and diagnostic criteria does not explain this rise and how insulting to pediatricians that they missed diagnosing children with neurodevelopmental disorders. If they really missed them, that should have called for a revisioning of pediatric medicine. And exactly where were all the autistic adults that they missed as children? Well, they weren't there because they were never missed. An increased number of immune-stimulating interventions early in life dysregulates the developing immune system or central nervous system in genetically or epigenetically susceptible individuals. Some animal studies and limited human data suggest that aluminum adjuvants used in some vaccines to boost immune response accumulates in tissues and impact neurological development. Aluminum is a neurotoxin. The CDC uses epidemiological studies, the most easily manipulated, to cite that there is no causal relationship here. But that is the problem. Epidemiological studies can rarely provide a causal relationship, but you can't use an epidemiological study to prove having sex causes pregnancies, for example. Challenges in establishing causation. The design of vaccine safety studies, a misnomer right out of the starting gate, lack the granularity to detect long-term, low-incidence outcomes across a broad population. The vaccine safety study for Hep B lasted just a little more than 4 days. That is obviously not a safety study unless all one is concerned about is sudden death. Another complicating factor is the absence of vaccinated versus completely unvaxxed cohort studies in mainstream research, primarily due to faux ethical constraints. However, several independent and retrospective studies comparing health outcomes in variably vaccinated populations have shown differences in allergy, infection, and neurodevelopmental diagnoses. These studies are ignored even when they are done by the CDC itself. The Peter Aby study in Africa that looked at 30 years of DPT administration found a 10-fold increase in all-cause mortality in the vaccinated versus the unvaxxed children in Africa. In other words, we are giving vaccines known to cause harm. How ethical is that? Regulatory oversight and public confidence. The lapse in mandatory safety report filings by HHS has justifiably raised concerns about oversight. In a context where public trust is crucial, transparency and accountability must be non-negotiable. The close financial ties between vaccine manufacturers and regulatory agencies, through user fees and advisory roles, patents held by these agencies, and royalty kickbacks present clear conflicts of interest that undermine confidence in the objectivity of public health policy. A call for better designed long-term safety studies, independent review boards, and open access to clinical trial data is not anti-vaccine, it is pro-transparency and pro-science. A more nuanced understanding of how vaccines interact with the immune system, especially in a genetically diverse population, could help refine the schedule and identify subgroups that may benefit from alternative approaches. But that would cause vaccine hesitancy and interfere with marketing goals. Bottom line, the cumulative effects of the full vaccine schedule, especially in infants, have not been studied in randomized controlled trials, and never has a true inert placebo, saline or salt water, been used as a control, always another vaccine or the vaccine without the antigen in question. In other words, pseudoscience. Long-term outcomes, years or decades later, especially for neurodevelopmental or chronic immune conditions, are not systematically tracked post-vaccination. There are gaps in oversight and accountability, as shown by HHS not submitting the required safety reports post-1986. They had to be sued to admit that. Cumulative safety studies. A 2013 report by the Institute of Medicine, IOM, now the National Academy of Medicine, titled The Childhood Immunization Schedule and Safety, Stakeholder Concerns, Scientific Evidence, and Future Studies, reviewed available evidence. The IOM concluded, no studies have directly examined the entire immunization schedule as it is administered to children in the United States. So, you don't have to just take my word for this. Ethically, public health authorities sophomorically argue that withholding vaccines known to prevent serious illness would be unethical, making a randomized, placebo-controlled trial of the full schedule impossible. This is the justification used to not find out what they already know. This leaves observational studies, retrospective or prospective, as the only practical route. But even those are rarely done at scale with full transparency. And let us not forget the CDC whistleblower William Thompson, who stated the Infectious Disease Division of the CDC makes data disappear that reveals safety signals that could impact vaccine uptake. Conclusion. The rise in chronic health and neurodevelopmental conditions among children warrants a serious and scientifically grounded investigation into all potential contributing factors, including, but not limited to, vaccines. While the current body of evidence does not support the safety and efficacy of vaccines in preventing infectious disease, because the appropriate studies, if done, never get published without being manipulated or fudged, to use scientific lingo. But as a rule, they are just not done at all. Vaccines continue to be pushed because of the liability-free money they make for corporations that have captured many aspects of the U.S. government. The public health community must strive for transparency, improved oversight, and a willingness to reevaluate policies in the face of credible evidence. Something difficult today when our regulatory agencies are captured and the staff at those agencies are vying for lucrative jobs in pharma. Today, the goal of vaccine programs and vaccine policy is to sell vaccine, as many as possible and as often as possible, while telling the public these vaccines support lifelong health when there is no credible evidence of same. There is no profit in the cure, and the more sick the population is, the more money the medical cartel makes, and the less likely the population will have the time to see what is really going on behind the curtain. This is not the end, but it is the end of this video.